Hello everyone and welcome to the GI Endoscopy Author Interview Series. My name is Dr. Sonmoon Mohapatra. I'm the Consultant Gastroenterologist and Director of Advanced Endoscopy at Sai Institute of Gastroenterology and Liver Sciences, Odisha, India. So I would like to thank the editors of IGIE for giving us this excellent opportunity to discuss our case titled When Looks Deceive, Signet Ring Cell Carcinoma Masquerading as a Solitary Pinpoint Gastric Erosion. This case involved a 36-year-old female who was referred to us for evaluation of a small subepithelial lesion in the gastric antrum. So repeat endoscopy was performed at our center, showed a very tiny 2 millimeter depressed lesion at the posterior wall of the prepyloric region that was not noticed before. So because this was a solitary erosion, so we performed a more careful examination with narrowband imaging and chromoendoscopy. So NBI showed a more clearer view of the marginal elevation surrounding the depression. So due to the small size of the lesion, the microvascular and microsurface pattern could not be reliably assessed according to the VS classification, and a clear demarcation line was not evident. So after application of chromoendoscopy, a thorn-like encroachment became apparent along the lesion's margins, raising the suspicion of malignancy. So the biopsy was performed from the lesion that revealed signet ring cell carcinoma. Early recognition allowed us to perform an endoscopic submucosal dissection, and there was no residual tumor noted. So the key learning points from this case include the importance of a meticulous mucosal examination and maintaining a high index of suspicion for early gastric cancer when subtle mucosal abnormalities are present. Early undifferentiated gastric cancers can present as flat or slightly depressed, whitish or pale lesions, often without any overt mucosal changes such as ulceration or elevation, making recognition under white light imaging challenging. Magnifying endoscopy may demonstrate a Kurskew type of microvascular pattern. However, such lesions can remain undetected even with magnifying endoscopy because tumor cells may proliferate beneath an intact foveolar epithelium. Chromoendoscopy remains an valuable adjunct in these situations as it enhances the lesion's border and improves assessment of the mucosal surface. Targeted forceps biopsy of any pale, flat or depressed mucosal areas suspicious for subtle neoplasia is essential to differentiate neoplastic from non-neoplastic lesions. So in conclusion, solitary, well-defined gastric erosions, even when very small, should not presume to be benign and should be carefully evaluated and biopsied when suspicious. Thank you.